The ethical issue I chose is healthcare affordability. Healthcare affordability is a top concern for residents and consumers in the US. Access to care is the ability to diagnose, prevent, treat, and manage health impacting conditions. However, access reflects on affordability, accessibility, accommodation, and acceptability. Affordability is determined by providers' charge services and the patient's ability and willingness to pay. The cost of healthcare has become a barrier for the US over the years. Some populations struggle more than others, and whether they experience high premiums, higher deductibles, and copays, or soaring prescription prices, there are ways for Americans to overcome these barriers and gain access to affordable healthcare. Some main issues in the affordability of healthcare are high premiums, high deductibles and copays, as well as drug prices. High healthcare costs affect uninsured adults, and more specifically, those with lower income, adults 65 or older, as well as Black and Hispanic adults. Many adults in the US have delayed or gone without medical care due to cost. Those who are 65 or older have found it difficult affording services. The larger share of Black and Hispanics have also struggled to afford types of care due to high premiums. Those with health insurances already struggle with affording their insurance deductible, and others are worried about being able to afford their premiums. A high deductible health plan can keep your monthly payments down. However, it is not all that it seems to be. High deductible health plans can put you at risk for medical debt. For example, one may get stuck with a large medical bill that becomes unaffordable over the years. HDHPs also only cover preventative care, meaning that if you are in need of an emergency care, chances of paying out of pocket are high. Another downside is putting your future health at risk. Due to the high out of pocket cost, you may not want to go get treated. Avoiding Avoiding visits and treatment can lead to a higher medical bill if the treatment becomes an emergency. Unfortunately, choosing a healthcare plan is a gamble, and weighing your options is a good idea when choosing between out of pocket maxes. Prescription drugs is a component of routine for many US adults. However, those currently taking prescription drugs have difficulty paying for them. And unfortunately, the increase of prescription drugs strains a lot of healthcare budgets. The high cost of prescription drugs forces people to cut back on their medications. In other ways, they are forced to ration their medication. For example, about 23% of adults have admitted to either they or someone in their family refusing to get a refill. They have also admitted to cutting their pills in half to save for the next, as well as skipping doses due to cost. People who live in a household with lower income, for example, Blacks and Hispanics, are the majority to experience these battles. Purchasing medications outside of the US is also common in these households due to the cost of what they experience in their own community. About 8% of adults have traded as well as accepted donations of leftover medications from others. Some ethical considerations to keep in mind is mainly focus on American politics and how healthcare is a major issue. Healthcare is a major issue in American politics, and debates relating to coverage and costs of healthcare continue to rise. Policies that relate to coverage include those who have received health insurance, the costs and how they are paid, as well as specific coverage. Reducing the number of those who are uninsured and how to fix this issue is also an ongoing debate. If deductibles and premiums are too high, how can they address and correct this issue under federal coverage programs? The coverage policies we have today are government programs that pay base shared burdens between those with larger and smaller healthcare needs. More than 90% of Americans are insured. Some are insured by employers, and others are insured by programs such as Medicare. However, for those who are uninsured, policymakers must address the way people receive coverage. Policymakers often support solutions that reduce eligibility, such as Medicaid, while others are concerned with reducing premiums and looking for ways to broaden eligibility. Policies related to healthcare costs are determined by two problems: the healthcare services that patients receive and how the prices for their services are paid. Policymakers are also faced with the challenge of delivering valuable service to those in need. One approach is reforms. Reforms give healthcare providers financial incentives. It could be used to reduce utilization without harming patients' health. Policymakers also focus on lowering healthcare prices by regulating public options. No matter the route, there will need to be a balance of prices and the concern of driving prices too low. Without balance, this may jeopardize access to care for some. That leads me to understanding the ethics and legalities. Defining and applying ethical and high standards of care requires a commitment to carry out his or her duties to patients and community. There is also a requirement to ethics in the healthcare to perform the use of best practice standards to the maximum extent under the location that the professional is working. In the relation to access and costs of care, the Affordable Care Act health reform brings important ethical issues. The provisions of the Act cover the expansion of insurance coverage, costs, and prevention. The goal is also to improve health outcomes at a reduced cost. For an ethical healthcare system to have a positive impact and results, four fundamental goals have helped shape these expectations. The first is the need of high-quality healthcare that provides exceptional benefits. The second is the freedom of choice. This is important for patients to decide who, what, and where when gaining access to healthcare. The third is the affordability of care. And the fourth is the share of cost benefits of healthcare. Thus, it is important to understand and respond to ethical considerations related to the ACA. Healthcare professionals have a responsibility to deliver care that follows laws. Efforts to reform healthcare in the United States have avoided human rights. Access and cost of care should be a right and not an option. The ACA does establish a norm that everyone deserves to afford access to healthcare. Therefore, it is important for healthcare professionals to understand the ACA and how it is related to their everyday duties. Through practice, education, and interactions with diversity of society, you gain an ethical perspective of constitutes healthcare for individuals who are at a disadvantage. Moving forward to ethical arguments, the importance of public health policy is crucial because it brings forth research and theories of public health into the world. It also allows creation and action to find solutions for major problems. In the example of the Affordable Care Act and access and costs of care, the political environment shapes the nature of the plan. In our current environment, there are always challenges to guarantee health coverage through the government. Ethically, the challenges within the programs we have today and that compromises that arise with deferring the goal of comprehensive coverage reform. The next question is whether the use of market-based solution meets ethical principles that guide the provisions. The principle of utilitarianism emphasizes the expansion of benefits in any form. The ACA grants millions of people access, otherwise they would have been denied while the industry depends on the economy. The market-based reform grants to those who are poor and cannot afford the care they need. It also promotes justice by offering fair resources to those who want it, opposed to just belonging to an eligible group. The promotion of these ethical provisions leads to compromises associated with market-based reforms being ethically justified. Indifference. Accepting the ethical foundation through private market discloses ethical concerns that need to be addressed. For example, the gains in coverage will not equally be distributed to the millions of people who remain uninsured. Those who are uninsured under the ACA will lack coverage due to financial cost. It will also impose a substantial economic burden on those who are not qualified for subsidies but have already purchased the coverage. Therefore, it is unethical and there are too many disparities in the allocating benefits. The Affordable Care Act does not promise access to care. However, it does aid with coverage to pay for it. If a patient cannot find a physician or hospital insurance, coverage is of little value. The ACA will leave an ethically important part of their accomplishments unfulfilled if beneficiaries are not able to use that access to obtain care. So, what is the ethical direction for the United States in the direction of health policy? It is complex. The public and private interaction of today is underdeveloped and it leaves a range of possibilities. The systems of the past and today may not have included features that distinguish outside costs, and the United States has already exhausted their means and has gone far with the market-based government healthcare programs. It is important moving forward that it minimizes any ethical shortcomings that can have life and death consequences. Coverage and affordability will always be a shortcoming. The ACA redresses this concern. It would be ethically correct to implement and to redesign, shape, and build healthcare reforms in the most equitable and effective way. As a follower of Christ, in evaluating healthcare through the Bible, I feel it is our duty to pursue equality in healthcare for everyone, as it is a duty for policymakers to provide and consider equitable healthcare. In Jeremiah, Micah, and Matthew, Christians are called to pursue the welfare of the city by social justice and caring for the sick. Our health should not be jeopardized because of socioeconomic class. No one should have to make the decision between buying food or life-sustaining medications. Healthcare is expensive and will continue to rise. Christians are called to bear one another's burdens, as mentioned in Galatians 6:2. As easier said than done, part of the solution is to address and fix healthcare costs and prevent financial ruins. The Bible also mentions that everyone is worthy of equal value because God created us in His image. The intrinsic value in individual does not make a difference of any demographic category. If we all have equal value, there should be equality for health.